In this video, I'm continuing my series of videos on exercises that I commonly use with my patients in the clinic for treating shoulder pain. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsborough, and in this video I'm going to show you how to do an exercise called Cross Body Adduction. Cross Body Adduction. Some clues that Cross Body Adduction might be the right exercise for you are: 1, you don't have limitations with extension or internal rotation. Let's say my right shoulder hurts. It hurts when I lift weights, when I do bench press, when I do rows, and it hurts when I try to raise my arms up above the head. It hurts. It's either hurting at the end or it's feeling like it's a little stuck, or this direction, or both. But I don't have limitation in extension. Both arms reach equally as high. And behind my back, my left arm reaches up to here, my left hand reaches up to here. Same height, and it doesn't feel restricted. If you don't have a loss of extension or internal rotation, those exercises might not work for you because we're not restoring anything that you've lost. You haven't lost it. If that's the case, let's go to cross body adduction. Or if you did have limitations with extension and internal rotation, you did repeated extension and or progressed to repeated internal rotation, those have now been restored. Your shoulder is better, but you still have some pain. If that's the case, let's go to cross body adduction. Repeated cross body adduction is very simple to do. So we're saying my symptomatic side is this right side. You reach across, and then you give a little pull over pressure, and then back. Pull over pressure, and back. So go across my body, pull, and then back. Cross my body. Some people like to pull this way. That's fine. When you do this, what you should be feeling is some strain in the back here, because you're opening up those tissues back there. As you do this, you might get a little discomfort in the front. That's okay, as long as it doesn't become worse and worse. Ideally, as you do this, it feels better and better, meaning looser and looser, as you do your 10 to 15 repetitions. If your shoulder starts to feel miserable as you do it, then back off and don't do it. Once you've done your 10 to 15 reps, test it out. Sometimes we've got to progress this. So for some people, they're not quite getting to end range, or we've got to do a little bit more force with this. In order to do that, we're going to use the wall to add overpressure. Okay, so we've been doing repeated cross-body adduction with this self-overpressure. It's helping, but it's not getting rid of it, and we've done several sets, or we've done it for a couple of days. Or it just didn't help at all, but it didn't make us worse. Let's add overpressure. We're progressing force. To do that, we're going to use our own overpressure, our body weight, and a wall. So in this case, elbow goes onto the post, not the point of the elbow, the pad if you can, hand still here, and you're going to lean in, kind of lean into it. Overpressure. I can really feel that's a good stretch. Lean into it, and then back. Lean into it. I'm not pushing away like that. Just move toward and away from the wall. Pressure on, pressure off. I lean into the wall, and then away. Lean into the wall, and then away. I feel a great strain here. It's really mobilizing the posterior capsule of my shoulder. I lean into the wall, overpressure. Pressure on, pressure off. Pressure on, pressure off. I do get a little pinch in here. That's okay. It's not getting worse as I do it. I'm just leaning into it a little bit and then off. I'm not killing myself with it. It's just a little overpressure. I'm getting farther into that range. Pressure on, pressure off. 10 to 15 repetitions of that, and then try it out. See if you feel better afterward. Try what had been painful before. Whatever had brought you to watching this video, try that activity out or that exercise out. See if it feels better now. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsborough, showing you how to do cross body adduction. The dosing for this exercise is 10 to 15 repetitions every 3 to 4 hours, or is needed for pain. If you're an athlete and or a strength athlete and you get pain during your sport, you might do this exercise in addition to every 3 to 4 hours, before and after your workouts. and or even before, during, and after your workout. If you like what you've seen in this video, subscribe to our YouTube channel and click on the little bell. That way you'll be notified each time we upload a new video showing you how to do one of these powerful exercises for eliminating pain from your life. Like the video, share the video with your friends, and leave comments below. Let us know if you've tried this exercise and if it worked for you. If it didn't work for you, let us know that as well, because that way I can suggest a modification that might make the exercise more beneficial to you, or I can suggest another exercise that might be more appropriate for you.